Congratulations, you're looking so fresh.
Thank you.
You all know I'm a doctor? Who told you I'm a doctor? How many of you are scared of doctors? Pretty scared of doctors, right? How many of you been to see doctor? Everybody. How many of you have been ill and to stay at home? Cough, cold, fever, stomachache. Everybody. Did your mama, dada take you to doctor then? Yes? How many of you got medicines? And how many of you got injections? Everybody is sick only, yeah? Okay.
Today, it is our privilege to introduce our esteemed guest, Dr. Clarence Gonsalves, a dedicated pediatrician and neonatologist who has devoted his life to the care and well-being of children. Dr. Clarence Gonsalves completed his MBBS from Padma Shri Dr. D.Y. Patil Medical College, Navi Mumbai, and further specialized in child health by earning his DCH and MD degrees. Throughout his distinguished career, he has worked in reputed hospitals and has gained extensive experience in pediatric and neonatal care. He is currently serving as a pediatrician and neonatologist at Cardinal Gracious Memorial Hospital, Vasai, and is the founder of Bliss Children's Clinic and Vaccination Center. His dedication, expertise, and compassionate care has touched the lives of countless children and families in our community. Today, Dr. Clarence Gonsalves is here to enlighten us on the importance of taking proper care of our health and why we should avoid staying at home when we are unwell without seeking medical advice. His valuable guidance will help us understand the importance of timely treatment and healthy habits. Let us extend a warm and heartfelt welcome to Dr. Clarence Gonsalves with a big round of applause.
Good morning again. Can you see? Can you read that? See the doctor on time. When do you see a doctor? When do you see a doctor? When you are sick. When you are in a hospital. Has anybody received vaccines? Vaccines are also given by doctors and nurses. It's a very bad day. You go to take vaccines, right? Everybody comes home happy after the vaccines. But while going to the clinic, everybody is crying, right? Who cries at the doctor's clinic? Everybody cries. Okay, so doctors are there to help you feel better. Okay? Not to scare you. Okay? Don't just take medicines. Go to a real doctor for help. When you feel unwell, what happens? There's a lot of medicines coming, bitter medicines coming. Okay? Who gives you the medicines? Very well. Yes, doctor. Doctor writes the medicine. But who gives you the medicines actually? Your parents. Mama, dada, na? Yeah, na? You take on your own? Yes, who takes on their own? Who are take on their own? Okay, many people are very brave, huh? So today we'll learn something else. Okay. What is the most common things that you feel ill with? It's all over there. See, runny nose. You can read what all is there. Tummy ache, runny nose, vomiting, loose motion. Very embarrassing, no? What else? Cough, sore throat. Anybody has sore throat today? Coughing today? Yes. Everybody is going to get sick now. Everybody is coughing. Good. Yeah. That demonstrative us. Okay. Most common things is runny nose, stomach ache, sore throat, infection. It's a common infection. No, it's a very big epidemic. After the rainfall, everybody starts getting sick. The sick season comes in when your school starts, when June, July comes, when Diwali season comes, right? So that time there are a lot of doctor visits. You have to go to the doctor with your parents. Okay? Very bad stomach ache. Has anybody had a very bad stomach ache? Somebody had to go home also after the stomach ache. So bad. Somebody got admitted to hospital with a stomach ache. Who was in the hospital? Anybody had been in the hospital? 2 days, 3 days, 5 days? So many. Doctors are going to be very happy with your school. What else? Anybody got hurt on your finger, cut on your finger? Yes. Very painful, no? Running around, you will fall and scrape your knees, fall on your knees, running on the playground. Yes, very painful. Who did you tell it to? After you got hurt, after you had a tummy ache, after you cut your finger. Who did you tell this to? Mama and Papa. Who else? Who else can you tell this to? Teacher, very good. Who said that? Very nice. Okay, so in school, your parents are not there to take care of you, but in school, your teachers become your parents. They take care of you because they love you. Okay, so over here, when you get hurt, your teachers are your parents, right? So when you get hurt, you are going to tell your teachers. In school, you are going to tell your teachers. Who all went to your parents when they were not well? Almost everybody. Who all went to the medicine box and took on your own medicines on your own? So many, really? Are you sure? Really? So many people take medicines on their own? Who taught you this? Parents told you. Don't blame parents. And who was the bravest and didn't tell anybody? I got hurt, didn't tell anybody, no. I went to school, I came back, didn't tell mama, dada, didn't tell parents, didn't tell teacher. Who are the bravest? Okay, so today I'm going to tell you that is not bravery. Okay, you have to tell somebody when you are not well. When you got hurt, when you get hurt, you have to tell somebody, you have to tell a grown-up. Okay? Who's that? He's a good person. What all is he carrying? His pockets are overloaded. What instruments does a doctor carry? Stethoscope, yes. Anything else? Thermometer, you can see that, right? What else? First aid kit. Okay, maybe not all doctors, but yeah, sometimes when you're in an emergency, somebody will come, a nurse or a doctor can come with a first aid kit. After they see their throat, say, and what does doctor do? Torch, right? Anybody ever went to ear doctor? Ears, everybody goes to all doctors. What does the ear doctor see your ears with? It's a special torch, right? A doctor is a specially qualified person who is studied enough to write special medicines for you on a piece of paper. And that is honored by the chemist. You have to take it to the chemist to show that paper, then you get the medicine. Okay, this is how you get medicines, and your parents will give you those medicines. Okay? So stethoscope, torch, thermometer, and we examine patients and we try to find what is wrong with them. And accordingly we give medicines. Okay? If we stethoscope, there is a medical term. It is also called a otoscope. Otoscope means it's a torch to see inside your ears. If you have a ear pain, there is some infection inside your ears. And thermometer. What does thermometer do? Change the temperature. Check the temperature, whether you have fever or not. Right? So, this boy is, what is going on? Doctor is looking in his ears. So maybe he got a cold and after that it will become a ear infection. So, Mama has got a poor doctor. Mama has got a poor ear doctor. What happens in the doctor's office? Everybody is crying. Everybody is howling. It's very noisy. And the children's doctor is the noisiest place. What happens in the doctor's office? What does the doctor do first? Doctor checks. Even before you need to check your weight. You stand on a weighing scale and somebody will write your weight. You go to a doctor and you check your weight. Yes. Yes. Okay. After that, what happens? Somebody makes the paper. See, you write your name, your age, and then weight. You write it on a piece of paper. Right? Then what happens? Okay, most children, all of them are very smart children. They can always talk to the doctor. But sometimes you're very sick, you're crying. So your mama, your dad will tell doctor what is wrong. Somebody got a lot of tummy aches, you can't speak also. Where does it hurt? We ask you where does it hurt? Since how long it is hurting? And we check for your ears, nose and throat is checked. And after that, what do we see with the stethoscope? What is doctor like with the stethoscope? Heartbeats. What else? What is needed? Lungs and heart. Okay, if you have a very bad cough, you will listen to the heartbeat. Okay, you check your temperature. Okay, and then if you have a tummy ache, we make you lie down also. And stomach is also checked. Okay, to see if something is wrong in your stomach, right? How many people get scared during the examination? You're very scared. You're always raising your hands when you get scared. Who else gets scared of the doctor? Yeah. So little scared is fine. Okay? But doctors are there to help you. Okay? Not to scare you. To make you feel better. Okay? Everybody is getting bored. Doctor is making you feel better right now. Yes? No? Everybody wants to run away. No, no? Do I look scary? I look scary. Do I look very scary? No, no? Yes. What is that saying? Yeah. So, you to see the doctor when you have sometimes, many times your parents will use some homemade medicines also. Many times like for a small fever, a little cough, cold, your mothers are very wise. They make you some ginger, lemon and honey. And with that also sometimes you can get better. Okay? Many times you don't need to have a proper medicine also. Sometimes they put balm on your stomach, with that also you start feeling better. But when do you see a doctor? When do you see a doctor? Even if, you want to say? Yes, so homemade medicine. So first, very minor things. Your mama or your dad will always try something homemade. Okay, before you get very bad medicine. So many times it works also. But what happens if that also doesn't work? When do you see a doctor? When that cough, cold that you have, or 3 days, 4 days, 5 days, still not getting better, that time you go, your parents will take you to a doctor. Okay? A fever that is not going with only fever medicine, sometimes you have a fever medicine at home, your parents will give you that fever medicine at home. But even with that, when it is not going, you have to go and see a doctor, right? And very, of course, very hurt very badly on your leg and something is broken or something, immediately you have to take it, you go to the emergency room, right? Okay, so that time you see a doctor. When you have something like cough and you start feeling very heavy in your chest, that time you have to immediately go to a doctor. You have to tell your parents and you have to go to a doctor immediately. Okay? Medicine is not like candy, it's not for everybody. Not everybody can take it. You have to take it after a permission from your doctor to your parents, and those parents will give you those medicines. Okay, you are not supposed to take those medicines on your own. Till you are big enough, till you are old enough to take your medicines. Okay? Medicine can only help if chosen correctly by the doctor, because we have to give you in a proper dose. But you have to be given medicines, that child cannot take medicines. Every medicine is different for every child. Okay, so you have to be very careful while taking those medicines, and we have to prescribe them according to your weights. That is why we take your weight. First thing what we do is we take your weight. Okay? Medicine is like a key, and the doctor knows which lock it opens. Okay, remember. What is self-medication? What is self-medication? The people I am asking you what is self-medication? Self means self-medication. Taking medicines on your own. Okay? For children, taking medicines on your own is not encouraged. Okay? We are here to tell you you're not supposed to take medicines on your own. You have to take it from your parents only. Okay? So self-medication. What is the harm? It can make the illness even worse. It can harm the stomach, kidneys, liver. It can make you even more sick. Okay? If you take the wrong medicine, if you take it at the wrong dose, it can cause allergies, rashes. You can start getting the red rashes on your body. You start throwing up. You'll get even more sick otherwise. Do not take any medicines without your parents' permission, without your doctor's permission. Okay? Can you see a comic story? Huh? Everybody likes comic stories. Yes? Anybody reads comics? Comic books? Anybody? I used to read a lot. I have thousands of comics at home. Okay, so this is Timmy. What happened to Timmy in the morning? Oh, I don't feel so good. I think I got a fever. Timmy is very smart. Timmy is over smart. What did Timmy do? Mama was busy. She went. What does the second picture show you? Mama was busy, so he went to his sister's medicine box. Last week, my sister got fever, that is why Mama gave the same medicine. I'll also take the same medicine. Mama is busy, it's okay, I'm a big boy, I'm a very smart boy. So what did Timmy do? He took his sister's medicine. Mom is busy, I just take this. This looks like my sister's medicine. So what happened to Timmy? Timmy felt even more unwell. He started vomiting. He started vomiting again and again. Oh, my tummy hurts even more. So after that, parents got worried. You know, Dada came from work, and Dada and Mama both came to the doctor. The doctor examined him and gave him proper medicine. But what he told, you're not supposed to take medicine on your own. Can you read the last? Next time, call the doctor first before giving the medicine on your own. Okay? Do you understand the story? What's the moral of the story? Do not take medicines on your own like Timmy. Okay? Don't be over smart like Timmy. Always tell an adult about your illness. Never using medicine on your own. Can you see what these pictures tell you? That is Timmy only. Timmy from the comic store. What does that first picture tell you? Yes, so always tell your elder. Maybe he's safe and a loved person. Maybe his mama is standing there or maybe grandma is standing there. And maybe he's telling his elders, maybe somebody. Second picture. Fever moment. Maybe stomach ache, vomit and fever also. He's holding a big thermometer, see. Right? So don't hide your news, okay? When you're feeling sick, don't hide it from anybody. What does third picture say? This name is Mama. Ask to call a doctor. Your parents should already know when to call a doctor. We are all parents, they are all very nice. Parents should not just keep it to themselves. They can give you some home medicine, but they know when to call it. So don't hide it from your parents. So that your mama or dada can call the parents. And what does the last picture tell you? Yeah, so that is the last picture. Don't take that medicine. That was sister's medicine. Again, Timmy was trying to take that. See, Timmy's hand and Mama is telling you no. See, Mama's hand is also there. Okay? When you are not well, what kind of hygiene do you maintain? How do you take care of yourself? First picture, again. Can somebody there? Yes. Yeah, raise your hand. Say, wash your hands often when you are not well. Okay? When you have a cough, cold, you wash your hands very often so that you don't spread the disease to others. Second picture. Yeah. Yes, cover your mouth when you're sneezing. Many times you don't have a hanky. Always sneeze it like this. You can do so that it can spread around. Third picture. Yeah, use an hanky or use tissue papers, then you can throw them and dispose them properly in the dustbin. Okay? Fourth picture. Sanitizer. Everybody heard of sanitizer? So hand sanitizer and surfaces, all the places, your desk, your study table, your dining table where you sit, it should be nicely clean. And last, don't hide it from the last. What is the last picture say? What do you think? Mama is helping. So Mama is telling you rest at home, okay? Don't run around. It doesn't feel good to just stay at one place and your body needs that strength to recover its strength. So you have to rest. Your mama, your dada will always help you. Okay? Okay, what do these pictures tell you? Rules for safe use of medicines. How to keep your medicine safely in your house. So in the cupboard with a lock and key. Okay, your parents. This is your parents' job. They will put them with your mama, dada, that all your medicines will be kept in the cabinet, in the cupboard, with a lock in place. Okay, so you should not be handling the keys. What is the second? What does the second picture say? Yes, before taking any medicine, you always ask your mama, your dada. Third, in school, there's a blackboard there, right? Who is Timmy telling this to? Teacher. So at home you tell your parents, in the school you tell your teachers. Very good. What does the last two pictures say? Again, it is you to take your grown-ups and they will call the doctor when there is necessary. Okay? Or they will tell the school nurse. If they have a school nurse or if you have a sick room in the school, they will take your parents, your teachers will take you there. Okay? There are again three pictures. Okay, let's see. Who do you think is a good doctor here? Let's see, there's a lady doctor treating a little boy. Is that person, that doctor knows how to give you medicine? Yes. Most doctors will give you the proper medicine, right? Second is your neighbor auntie. Neighbor auntie, she means very well. She loves you, she takes care of you. But because that little girl is not feeling well, she gave her own medicine to her. Is that right thing? Is that the right thing to do? No. It is not a right thing to do. Not like we say. Not everybody's medicine is Not everybody's medicine suits any other person. Okay? That is that auntie's medicine. You cannot give it to anybody else. Okay? Unless a doctor sees. And that is what pharmacy, a chemist shop. And he is giving a medicine to that woman who has a cold. Is that right? Is it right? Very right. It is right when the woman gives you, she has a prescription from the doctor. She has medicines written on a paper from her doctor. Okay? Giving on their own also from a chemist is not a right. Okay? Since the proper chemist is giving that lady medicines that were given by the doctor. So it is a good. Okay? So neighbor auntie, not a good one. Okay? So we'll quickly wind up. Okay? What did we learn today? First thing, when you are unwell. Yeah. What else? You can read. When you feel sick, tell an adult. Because they know how to take care of you at home. And if not, they know when to take you to an expert doctor. Okay? Ask to see a doctor. Do not use random medicines on your own. Can you repeat after me? Do not use medicines on your own. Repeat. Again, one more time. Do not use medicines on your own. When you are unwell, ask to see a doctor. Experts, they can check you. So doctors are there to make you feel better. Okay? So there is no need to get scared to go to the doctor. Sometimes going to the doctor becomes so difficult that no, I don't want to go to the doctor. No, I'll stay home only. I'll stay home and see if I get better. No. Okay? So remember, your parents will decide when to take you to a doctor. Okay? Taking medicines on your own is dangerous. It can make you even more sick. What did we learn? Stomach, kidneys can get damaged if you take it in the wrong place. If you take the wrong medicine, it can make you even more sick. Okay? Safe choices will make you also consult a doctor. Consultation. When you go to a doctor, it is called a consultation. What is it called? Big word. Consultation. Okay? Okay, so last time, be brave. Okay? Going to the doctor requires strength. Okay? Because we're not all like you're already sick and you will feel very scared in front of the doctor. Huh? But we're all there to take care of you and make you feel better. Okay? So be brave and visit your doctor with your parents. Okay? Wait for your illness or sometimes for your vaccines also. Sometimes you go to the doctor for the vaccines. What do vaccines do? What are vaccines? They are injections. Why is the injection given? Simply to take needle. What does that needle in that injection do? What? It is a vaccine. Vaccine is an injection that protects you from diseases, to prevent. Okay? To make you feel strong, to make you stronger. It improves your ability and makes you stronger. Okay? I won't bore you. Last slide and then I think we're done now. Okay? So, thank you students. Thank you for learning with us. Okay?
Good morning everyone. On behalf of our principal, Sister Flavia, the teachers, students and the entire school community, I extend our heartfelt gratitude to Dr. Clarence Leslie Gonsalves for being with us today and sharing such valuable insights on health and well-being. Your informative talk helped us understand the importance of maintaining good health, recognizing the signs of illness, and seeking timely medical care. Your message reminded us that good health is our greatest asset and that simple healthy habits can make a big difference in our lives. Thank you, Doctor, for your time, guidance, and dedication to the well-being of children and families. We truly appreciate your inspiring success in your noble mission of healing and serving others. I request Ms. Riona and Master Rudra to present a gift and card to Dr. Please give Dr. Clarence Gonsalves a big round